Hello, I'm Michelle Powers, and this is a special edition of Current News. This week, another 4.4 million Americans are out of work. Meet two Catholics who are losing money but finding God. And the story of one couple who was just days away from having the family of their dreams. How the coronavirus is attacking the foster care system. Plus an undetected killer, not COVID-19, but the Spanish flu. In 1918, religious sisters were on the front lines. And the doctor is in. We're asking him about a scary new theory. Is coronavirus causing strokes in young adults? All that and more on Current News Special Edition. American jobs are being dissolved at a breathtaking rate as the pandemic leaves millions out of work. Current News' Emily Druby introduces us to two families who had high hopes for 2020, but they didn't last long.
A crisis within a crisis. Millions of Americans are out of work as the coronavirus crushes the U.S. economy. Last week, an additional 4.4 million people filed unemployment claims, bringing the 5-week total to over 26 million. 43% of all American adults say they or someone in their home has either lost a job or taken a pay cut because of the pandemic. Regina Santoro is one of them.
Since the pandemic started, I have not had one offer on one property.
She's a real estate agent and the industry is basically shut down.
You know, it slows down, it peaks, it goes up and down, but I never thought we'd be closed.
It's terrifying.
So we are closed. So anybody who's looking for apartments, people are bleeding because I can't even put people in apartments. We are not allowed to shut.
Santoro's a parishioner of Holy Child Jesus Church in Richmond Hill. Like many, she tells us she has been trying to file for unemployment for over a week, but keeps hitting roadblocks. However, she says her family is still in better shape than most.
I'm a little frustrated about it. I'm more frustrated for some of my coworkers. My husband is still working.
Teddy and Rachel Aviles also attend Holy Child Jesus Church. Teddy is still getting a paycheck from his sports job, while Rachel, who's a flight attendant, is now on unemployment. They're safe for the time being, but like millions of other families across the country, they fear for what's next, concerns that are sharpened because they're parents to a toddler and new homeowners.
And we don't know what's going to happen in the future and how long it's going to take for flying to resume or for Teddy to get back to work. We really have we have no clue. No. And it feels really unsettling because you don't really know how to prepare for the future.
Emily Druby, Current News.
The coronavirus crisis has nearly every person and every household in limbo. One couple was just days away from completing their own family. They had an appointment in court to adopt a foster child. But because of the virus, those adoptions are now on hold, and so are their dreams. Current News' Jessica Easthope has their story.
Everyone's life has been changed by the coronavirus pandemic. Some are struggling to find work or buy groceries. Others are separated from family or have lost a loved one. But for Lindsay Gebhardt, her husband, Peter Schmidt, and their 3 children, one big part of life
That's what he said. Yeah.
has unfortunately stayed exactly the same.
Before the coronavirus, we were about 5 days away from adopting our foster daughter. We were prepared to go to court Wednesday of that week, and basically the world shut down on that Sunday.
The Catholic family who attends Our Lady of Good Counsel in Bedford-Stuyvesant has had their foster daughter since shortly after her birth. And for the last 3 years, they've been waiting to formally adopt the child who has been their own since day one.
You envision your adoption day for years, and the idea that you don't get to experience it in person is sort of, it's very bittersweet. She gets to hit the gavel.
For their family and so many others, that closure might not come anytime soon. Kings County Family Court has postponed hundreds of cases, and though judges are now taking appointments virtually, it's unlikely Lindsay and Peter's case will be a priority.
What they're prioritizing is emergency removals and custody cases. And those are going to start to be done virtually. we're sort of the bottom of the line.
Not only has the pandemic delayed a milestone in their lives, it was putting them at a higher risk than many.
With our foster son, he was doing weekend visits with his biological grandfather. And the idea of him going back and forth on public transportation and, potentially infecting each other got really scary.
For now, Lindsay and Peter's family is intact. There have even been some silver linings to the crisis.
They really have time to play together, bond together, and in that way, it is actually nice for them to have a lot more time together than they normally would have.
But they look forward to hearing the gavel slam. Jessica Easthope, Currents News.
With more and more people needing help, one of New York's most prominent organizations is stepping up to the front lines of the crisis. The Mother Cabrini Foundation is donating tens of millions of dollars to emergency response agencies, including Catholic Charities. As Currents News' Emily Druby reports, that money will be used to help those suffering from the pandemic.
For years, Mother Cabrini tirelessly helped immigrants, orphans, and the sick. Now her legacy of lending a helping hand lives on through the Mother Cabrini Health Foundation. They're stepping up in a big way to help out New York communities impacted by COVID-19, dedicating $50 million in grants as support for nonprofit organizations.
We could not stand by without doing something immediately to help those most in need.
We spoke with their Chief Programs and Grants Officer, Deborah Konopko. She says the money will help those who have been most affected by the pandemic.
So we're going to cast a very wide net and give grants out as soon as we can to help people in this really difficult situation that we're encountering in New York right now.
Catholic Charities, healthcare providers, food banks, and many more. Just some of the programs the money will help, and it's badly needed.
To help some of the most vulnerable throughout the state.
As of last week, nearly 800,000 New Yorkers had applied for unemployment. The need for food assistance is surging. Normally, about 2.5 million city residents turn to charitable food banks for help. The experts are predicting that number could double or triple. At the same time, senior citizens are afraid to go outside these days, and they're relying on services like Meals on Wheels to stay fed.
It's on the door.
Catholic Charities Brooklyn and Queens can really use the help. They've been working nonstop to make sure people are fed. With so many jobs lost because of the crisis over the past few weeks, Catholic Charities has had 2 pop-up food distribution operations in Corona, Queens. More than 1,700 bags full of food were handed out, each one with enough to feed a family of 3 for 3 days. And Catholic Charities could have distributed even more. That's how great the need is right now. Emily Druby, Currents News.
There's a lot more news headed your way. We take you back to 1918 New York City in the midst of the Spanish flu. If you were sick, it's likely nuns were at your bedside. Plus, the doctor is in here to answer your questions and tell us more about an unprecedented forewarning. Researchers are saying the virus may be causing sudden strokes in young people.
Now you can help us put your faith in the news. The next time you capture a newsworthy event, send us your pictures or video. It's easy. Go to netny.tv/send us, and you may see your submission on Currents News.
The influenza outbreak of 1918, also known as the Spanish flu, is considered one of the deadliest pandemics in history. Much like the coronavirus, it plunged the world into chaos. But just like today, heroes emerged. We are taking a look back to a tragic time where the church, and especially women of faith, were called into action.
The Battle Royal.
It was an undetected killer sweeping the globe as the world was in the throes of a deadly war. A virus so relentless it infected 1/3 of the world's population and killed an estimated 50 million people.
Adjusted for population today would equal about 220 to 440 million people.
675,000 perished in the United States alone. Author John Barry has written extensively about the great influenza, calling its impact lethal.
The 1918 pandemic killed roughly 2/3 of the people in a matter of weeks. It also concentrated on otherwise healthy young adults. The peak age for death was 28.
With no vaccine or medicines to combat disease, the Spanish influenza, considered one of the worst pandemics in modern-day history, quickly overwhelmed the medical community. As infections soared, Catholic sisters from all over the country were called to serve in new and profound ways.
They saw terrible things.
Sister Margaret Donegan has researched the extraordinary efforts of 14 Sisters of Charity who traveled to the rural mining town of Shamokin, Pennsylvania, a tiny community placed under martial law and surrounded by state police because of the high levels of the contagion.
They were bringing comfort to the patients. They would hold their hands, they would talk to them, they would pray for them. They would listen to their stories.
Stories so heartbreaking, they wrote their Mother Superior to tell her.
They had seen things they could never write about, and they had seen things they could never possibly imagine.
Women of faith, doing whatever was necessary to relieve the suffering.
They went into homes and they saw parents who had died and children huddled together. They listened to fathers saying, they were the breadwinners. What was going to happen to their wife and to their children? They saw mothers pleading to God to cure them because of the children who were at home.
From mining communities in rural Pennsylvania to makeshift encampments in Ohio and Massachusetts, these women cared for the stricken in hospitals, tented clinics, even private homes, many with little or no medical experience.
Putting their lives on the line to care for not only the Catholics of Philadelphia, but any person of any faith.
In Philadelphia, one of the nation's hardest hit cities, over 2,000 women religious were called into action. At least 23 of them lost their lives in the fight. A sacrifice the Catholic Historical Society of Philadelphia wants us all to remember.
It's really remarkable how quickly they all came together, just the church as a whole, in organizing and having such a cohesive response to this pandemic. They were really focused on helping as many people as they could.
Philadelphia, they were actually, it was so bad, priests were driving horse-drawn carts down the street, calling upon people to bring out their dead. They were digging mass graves.
100 years later, their example still shines as a model of courage and sacrifice. Sisters putting the needs of others before themselves, remembered by a grateful community and by one of their own.
They were bringing the compassion of Jesus to these people because they were not nurses, but what could they do but bring the compassion of Jesus to the suffering?
Now, more than 100 years later, while we have more tools and knowledge to combat a pandemic, there are still so many unanswered questions. Here on Current News, we're trying to answer your questions in our weekly segment, Ask the Doctor. Dr. Robert Tabali from the Catholic Medical Association joined Current News' Christine Persichetti. She started off asking him about a new report from doctors at Mount Sinai. They now believe coronavirus may cause sudden strokes in adults in their 30s and 40s. Here's Dr. Tabali.
One of the alarming things that we're learning, one should always remember that Western medicine has only been exposed to this virus for about 8 weeks now. And so a lot of things that may have been discovered before during the Chinese experience were not discovered. And so there have been quite a few young people with strokes. The virus seems to potentiate a clotting disorder, a cascade, and possibly through a classic medical problem called lupus anticoagulant syndrome. But a new rash that appears like almost like a bleeding under the skin could be a sign of that bleeding disorder occurring in someone with COVID-19. Doctors would oftentimes, we don't really know how to diagnose this yet, we don't know how to treat it yet, but patients when they're hospitalized are usually put on heparin to try to prevent clots. What I've been recommending my patients do is take an aspirin daily during this time when they have COVID. So there are many adults that may be suffering from strokes that we're unaware of as well. This is all new discovery day to day.
Okay, and yesterday during the president's press conference, he mentioned that there are experiments that are showing that sunlight that the coronavirus doesn't fare well under sunlight or heat. So what exactly does this mean? I mean, people who have COVID-19, it's not like if they sit in the sunlight, they're going to be cured.
This is on topical surfaces. This is not internal to the human body. So the word about disinfectants is very encouraging, like dilute solutions of chlorine bleach, like 5% bleach solution. The virus can only withstand that for a very short period of time. Same thing with isopropyl alcohol. That does not mean that you drink bleach or drink isopropyl alcohol. That's an absolute bad thing. Those are poisons to you. But having isopropyl alcohol on the surface of your skin or on your desk or your monitor or your telephone devices, this is virtually everything that we use to disinfect these surfaces to begin with. Lysol wipes, Clorox wipes, isopropyl alcohol. I didn't see hydrogen peroxide, but we do believe hydrogen peroxide is also active. So sunlight won't cure someone, but it will disinfect the surfaces, like the surface of my clothes, my glasses, my telephone, that type of thing. And so this is all good news. You can't, people have been asking me, can I take a light, an ultraviolet light, and put it inside my body and treat the coronavirus? And the answer to that is no, you can't do that. And being on a tanning bed or something like that, while that's a certain type of ultraviolet light, that's not what we're talking about here. That's not curative. And ultraviolet light can harm your eyes, your retinas. So we would advise you that the real meaning in this news is that surfaces that are in the sun, like playground toys and things like that, or your handrail outside your house, the real news is that those type of things are kind of like automatically disinfected by sunlight, if you do have sunlight.
Okay, and really quickly, there was doubts raised about ventilators because a lot of people are, on the ventilators aren't recovering. Do ventilators do more harm than good? You have about 20 seconds.
We're not really so sure. There was a recent report out from Northwell Hospital Consortium there in New York City area that showed that a large percentage of their patients on ventilators did not survive. There is a possibility that the ventilators could compound some type of problem. So doctors are trying to avoid ventilators if all possible. Even without ventilators, they're prone positioning patients, moving them from their back to their stomach, and finding that they can avoid the use of ventilators by certain positioning methods. It's always good to avoid a ventilator, and so it seems it could improve survivability as well.
That was Dr. Robert Tabali from the Catholic Medical Association, and he is in every Friday to tell you what you need to know about the latest medical developments involving the coronavirus and to answer your questions. So send them to askthedoctor@desalesmedia.org. We'll try to get to all of them. That way you can be safe and healthy. Again, the email is askthedoctor@desalesmedia.org. When we come back, a hymn of hope penned by a world-renowned composer, church music in the time of crisis, plus priests on a mission to bring the Blessed Sacrament to the doors of each of their parishioners. He's one of the church's best-known liturgical composers. Father Michael has written countless melodies many of us know by heart, but his newest song comes at a time when many don't want to sing. Currents News' Jessica Easthope has the story of a hymn he hopes brings hope.
Many are familiar with the music, but not the man behind it.
Altogether, probably about 300 pieces of music. Now, the one that everybody knows is on Eagle's Wings.
In Father Michael Jonkas's 40 years as a priest and world-renowned composer, he's never had to look too far for inspiration.
I know the liturgical texts kind of through and through, and I also am, as a priest, I'm trained in Scripture. So certainly the Psalms are the background to nearly everything that I do.
The same goes for his latest piece of music. It's called Shelter Me.
There was just this little germ of an idea for a song to respond to the coronavirus pandemic that we're in.
The lyrics take the listener through the same stages the world has gone through over the last several months, with lines like, mirrored in a psalm that's close to Father Mike's heart.
It was basically to take Psalm 23, which of course I've been praying for forever, and then adapt it or paraphrase it so that it could talk about our present day experience.
The song talks about wanting intimacy with God during this hard time. Father Mike says he hopes the song is used as a way of bringing the world together.
If it's anything like On Eagle's Wings, it'll eventually go way beyond the Catholic world. It'll frankly go beyond the Christian world, and it'll be something that many people of different faith traditions will be able to use in their prayer.
Father Mike decided his gift of music wasn't enough. He'll also be waiving a copyright and license fee for the song. It will be free to download and use in church for the next year. Jessica Easthope, Currents News.
Churchgoers are not only finding some strength through music, it's also being brought straight to them. Priests in the Diocese of Brooklyn are making a special pit stop, and they won't be done until they hit all their parishioners' homes. Currents News' Emily Druby has that story.
A sign of hope, of community, and of faith. Clergy from St. Helen Church in Howard Beach taking to the streets, processing with the Blessed Sacrament, bringing the church right to their parishioners' doorsteps, but from a safe distance.
The people here miss their church.
A unique way to give a benediction to the sick, to see their parishioners, and to make sure they're reaching out to everyone, including those unable to tune into the church's popular live-streamed masses.
But we also have an elderly population that is not watching online.
The church's pastor, Father Francis Cola Maria, says the idea came from the past.
Historically, this has been done during plagues. Processions of popes and bishops going through their dioceses or their parishes.
They will continue to do this every day starting at 1:30 p.m., taking a different route until they have covered the whole parish. And St. Helens is not alone. Pastors all over the country have been doing this as a way to stay connected with the faithful, including in Brooklyn. On Sunday, the celebration of the Divine Mercy at Shrine Church of Our Lady of Solace in Brooklyn included the visitation of the Blessed Sacrament through the streets of Coney Island, spreading an important message to their parishioners.
They are not alone in their suffering. That is the best message we could communicate through the best medium of the church, which is the Holy Sacrament, the Eucharist. God is visiting them to give them the healing, to give them the consolation, to give them the peace that they need at this time.
Just another way priests are creatively changing their approach when it comes to spreading the faith during the global pandemic. In Howard Beach, Emily Druby, Currents News.
And that is Currents News. I'm Michelle Powers. Thank you for joining us because we are putting your faith in the news. We leave you tonight with a moving tribute from a rooftop in Italy. Just for a few moments, the ambulance sirens were replaced by the sweet music of a violin, a melody both sad and hopeful, played for the workers on the front lines. Have a good night.